The past couple of weeks have been dominated by new cases of COVID arriving into our quarantine and managed isolation facilities at our border and the strengthening of our border defence. With no playbook to preempt the twists and turns of this virus, we will have issues to fix as we go. And it is right that these concerns are raised. And you will not find a harsher critic than me when things aren't perfect in our system. But it's important these issues are put into perspective and examined alongside the facts and also within the global context. And the overarching fact remains that New Zealand is in extremely good position, and we will fight to keep it that way. Catching cases at the border, as we will continue to do, is the system working. In the 13 days since the positive confirmation of the New Zealand sisters who returned from London to visit their dying parent, 82,862 tests have been conducted in New Zealand, with not a single case in the community identified. That represents 21% of all the testing we have done since the outbreak started in just the last 2 weeks. Since we began testing, we have been averaging 2,487 tests a day. In the past 2 weeks, that average jumped to 6,028. And as I say, still no evidence of cases outside of managed isolation facilities. On managed facilities and new cases, the evidence from the last 14 days is positive. All the new cases have been picked up through routine testing on about day 3 and day 12, and also through our health checks. That has meant that currently every active case in New Zealand is in a facility of some form, all 22 of them. In that same time, Australia has reported over 400 cases. In fact, they reported 37 new cases across the country on Saturday, and the state of Victoria reported 75 cases today alone, with medical staff now going door-to-door testing people in areas where outbreaks have occurred. And, of course, our best wishes are with our colleagues in Australia as they continue their battle. Globally, we are at 10 million cases. There have been 500,000 deaths, and the virus is sadly growing, not slowing. So it is not surprising that more and more New Zealanders are seeking to come home. That does mean some will bring the virus with them and into our managed facilities. It is unrealistic to think that we wouldn't have cases in that way, and that is exactly why we have these facilities in the first place. But let's also not forget why they want to come home. We have freedoms that few other countries have. Our kids are playing weekend sport, our bars and restaurants are open without restrictions, people are back at work, professional rugby and netball are being played in front of enthusiastic crowds, and people can gather in any numbers they like. We can also travel anywhere we wish in our beautiful country, but many other places around the world cannot do these things. Oxford University says we have amongst the least restrictions of any country in the world, something that we are all working very hard to protect. To stop the virus entering the community, we have strengthened our border defence arrangements. As we learn new information, we act on it. Yesterday, Minister Woods and Air Commodore Webb released their audit of the managed isolation and quarantine system and the government's actions in response. The audit report identified issues with personal protective equipment, PPE, and in particular, the sometimes inconsistent use of it. We are moving quickly to act on those findings in the report. Today, we're announcing an additional $150 million allocation for the purchase of PPE from the COVID Response and Recovery Fund, with a firm focus on ensuring consistent supply and use for our frontline border, airline and managed isolation and quarantine facility workers. This builds on the earlier invested of $200 million in PPE announced in April. DHB infection control teams, as I understand, will be working with frontline staff at managed isolation and quarantine facilities in the safe and effective use of PPE, because as many of you will have heard us discuss, that is key for PPE use being effective. We will also be ensuring that Air New Zealand has access to supplies of face masks for international passengers flying into the country. All returnees will also be required to wear masks when they disembark from the plane and travel to the isolation facility, and whenever they leave their room and enter a common area or exercise area in managed isolation. And again, PPE use has been in play. Our concern has been it has not been consistent within our facilities, and that is what we are working to fix. While we already have one of the strongest border quarantine systems in the world, we do not want to leave anything to chance. The latest investment means that health workers and those working as part of our border response can be confident they will have access to the PPE they need to stay safe and continue to keep COVID-19 out of our community.